welcome, Charlie. My name is Casey. I'm taking care of you today in the surgery area. This is entrance C, and this is where you come for your surgery. Follow me. We're going to stop here, and she's just going to ask you a few questions about your health. Okay. So, have you had any COVID-like symptoms in the last 24 hours?
No.
All right, and have you had a positive test or been asked to quarantine in the last 10 days?
No.
Okay, so I'm gonna go ahead and have you sanitize your hands and then put on a brand new mask for me, please. Yep, there you go. And that's all I need, you're set to go through. Good job, and you can follow me. Your parents will be taken to the registration area, where they'll be asked a lot of questions just about your insurance and where you live. And then we'll come over here, and this is our waiting area. So you'll sit and wait here until one of our nurses come and get you for your surgery. Got some TV, you can watch the TV while you're waiting even. And then we'll take you back to your area where we'll get you ready for surgery. I'm gonna stop on the scale first. We have a big scale on the floor here. You would stop here and get weighed and see how much you weigh and how tall you are. And then we bring you into this room here, okay? We have lots of goodies here waiting for you. We have you change into a gown and ask you just lots of health history questions and ask your parents lots of health history questions, like when your date of birth is, if you have any allergies, if you've had surgery before.
Okay.
And then you'd sit here and wait for surgery. Until the doctor's ready for you. Doctor would come visit with you, anesthesia would come visit with you until they were ready to go back to surgery with you. All right? And then the operating room nurse would come in.
Hi Charlie, I'm Kim. I'm going to show you all about the operating room.
Okay.
Okay? So once Casey and her staff get everything done and you're ready for surgery, then we'll go ahead and take you back for surgery. So let's come on back this way. So there's a long hallway. So normally on a day, those doors will be closed because we don't want anybody coming into the operating room with us that aren't supposed to be there. So see how the floor is different here?
Yeah.
So only people that are dressed like me can come on this side of the floor. You have to have your hair covered and special shoes on. So everybody else has to stay back there on that green floor. So we're gonna go into OR 1. So we have 7 ORs here, but we're just gonna go into this one. So wave your hand on that.
Whoa.
It's pretty cool, huh?
Yeah.
All right, so this is set up like we were gonna have belly surgery today. How neat is that? So you want to go over and touch some stuff over there?
Sure.
So these are all of the, we call them instruments. These are all of the instruments that we use to get into the inside of your body.
What are these?
So those are grabbers or graspers. We put little poke holes in your tummy and then put these ports in. And then you can use these to get down and inside.
Oh.
And then you can hold things. You want to practice? You want to try it?
Sure.
All right, let's go over to that blue table over there.
Okay.
All right, so let's come over here. The first thing that you have to do is we have to turn our light on. So come this way. And that standby button right there, hit that power button right there. Press and hold it. There you go. Now see how your cord lit up?
Yeah.
All right. So now we need to see it up there. So let's come over here. So we're going to go to video. Go. And we want to put it on that monitor 2. So put it on monitor 2 there. Now did it change?
Wow.
Sure did. All right, so now we're gonna practice, okay?
Okay.
So, see how little this camera is?
Yeah.
Okay, see our little pieces of paper here? Okay, so don't look down. Hold the camera right there and see your pieces of paper. Okay? And get your grasper. See if you can pick up those pieces of paper. Okay? Don't look down. It's like dribbling a basketball. Don't look down. And then put them in my hand. Good job. Don't look at it. Just look at the screen. Good. So you see how big they look up there?
Yeah.
And they're not very big, are they?
No.
Good job. All right. One more. Yes, you got it. All right. So there's lots of really cool things in here. We also have really big bright lights that we can see, and we can turn everything on and off from these computers over here where the nurses sit.
Wow.
So the doctors are working up there in that blue circle, and we're back here just controlling everything. So when we're all done, we take our instruments that we use, and they're all kind of mucky and gooey. So let's take them and go wash them, okay? So wave your hand again. All right. So we're gonna go down this way, down all the hallways. And now it's time for us to go wash our instruments. It's a long hallway, isn't it? Yep. We have lots of equipment and tools that we have in the operating room. So we have lots of spaces here to hide them all in. So we're gonna go down that way. Okay. And you can swipe your hand across it again. It's all about not touching a whole lot of stuff. Oh, I hear it running. All right, so we're gonna swipe our hand here. We're gonna come inside. So we gotta wash our dishes, right? Yeah. Okay. So we start at the sink. We gotta rinse them off, okay? So push that button down. So everybody's a different height. So now if you're tall or if you're short, you can set the sink to where the sink needs to go. So after we're done washing the sink, then they gotta go in the dishwasher. Okay? So see all that soap back there? That all goes up through the ceiling and it gets dosed into the dishwasher so that it can go. But we don't have to measure out our soap anymore. So we have this, and then sometimes we use really big things that don't fit in here. So we have our cart washer. And it's going right now. It's like a big, huge dishwasher. While you're waking up in the patio. So let's go over to the patio.
Hello, Charlie. Hi. This is where you'd wake up, you'd come in here on a bed, and we'd turn on all of our monitors, and we'd hook you up to some machines to make sure your vital signs are all good, make sure you're comfortable and that you're feeling good. And so when you wake up from your nap, this is what you would kind of see, is this area here with your nurse. Okay? And then once you're awake and you're ready to go see your family again, we take you back to your room where we started from, and we continue to monitor you there until you're ready to go home. make sure you're feeling good and ready to go back home. You can swipe the door again. And your room is back this way, down this long hallway again. We give you something to drink. We like to give you popsicles usually, ice cream, all that good stuff while you're waking up. The nurses would watch you here in this room. Continue to have you hooked up to your monitors, so your blood pressure machine, making sure your vital signs are good and that you're comfortable before we'd send you home
All right.
and end your stay, okay? Thank you for coming to see us today at St. Francis.